Which of the following actions is outside the scope of practice for a home health aide, HHA? A. Assisting clients with activities of daily living, ADLs. B. Administering oral medications as directed by a nurse. C. Performing sterile wound care procedures. D. Observing and reporting changes in a client's condition. Answer: C. Performing sterile wound care procedures requires specialized training and is typically the responsibility of licensed nursing staff, not HHAs. When measuring a client's blood pressure, the home health aide should: A. Position the client's arm above heart level. B. Use a cuff that is appropriately sized for the client's arm. C. Inflate the cuff rapidly to 300 mm of mercury. D. Allow the client to talk during the measurement. Answer: B. Using a properly sized cuff ensures accurate blood pressure readings. An incorrect cuff size can lead to erroneous measurements. A client with dysphagia is at increased risk for: A. Hypertension. B. Aspiration pneumonia. C. Hyperglycemia. D. Deep vein thrombosis. Answer: B. Dysphagia, or difficulty swallowing, can lead to food or liquids entering the lungs, causing aspiration pneumonia. The most effective method for a home health aide to prevent the spread of infection is to: A. Wear a mask at all times. B. Use alcohol-based hand sanitizer exclusively. C. Perform proper hand hygiene before and after client contact. D. Disinfect surfaces weekly. Answer: C. Proper hand hygiene is the most effective way to prevent the transmission of infections in healthcare settings. When assisting a client with left-sided weakness to transfer from bed to wheelchair, the HHA should: A. Place the wheelchair on the client's left side. B. Place the wheelchair on the client's right side. C. Encourage the client to stand without assistance. D. Lift the client without using assistive devices. Answer: B. Positioning the wheelchair on the client's stronger side, right side, facilitates a safer and more effective transfer. A client with congestive heart failure should be monitored for: A. Sudden weight loss. B. Edema in the lower extremities. C. Increased urine output. D. Elevated blood pressure. Answer: B. Edema, or swelling in the lower extremities, is a common symptom of congestive heart failure due to fluid retention. When documenting care, the home health aide should: A. Use subjective statements. B. Record information immediately after providing care. C. Include personal opinions about the client's condition. D. Erase errors completely and rewrite the entry. Answer: B. Documenting care immediately ensures accuracy and maintains the integrity of the client's medical record. To promote independence in a client with arthritis, the HHA should: A. Perform all tasks for the client. B. Encourage the use of assistive devices. C. Limit the client's physical activity. D. Provide meals in bed. Answer: B. Assistive devices can help clients with arthritis perform daily activities more independently and with less pain. If a client with diabetes shows signs of hypoglycemia, the HHA should: A. Administer insulin immediately. B. Provide a source of quick-acting sugar. C. Encourage the client to rest. D. Call emergency services without delay. Answer: B. Quick-acting sugars, such as glucose tablets or juice, can rapidly raise blood sugar levels in hypoglycemic episodes. When caring for a client with a hearing impairment, the HHA should: A. Speak loudly and rapidly. B. Face the client and maintain eye contact. C. Use complex medical terminology. D. Communicate exclusively through written notes. Answer: B. Facing the client and maintaining eye contact facilitates lip reading and ensures better communication. The primary purpose of range of motion exercises is to: A. Increase muscle mass. B. Prevent joint contractures. C. Enhance cardiovascular endurance. D. Improve respiratory function. Answer B. Range of motion exercises help maintain joint flexibility and prevent contractures, which are permanent tightening of muscles or tendons. A client with a history of falls should have their environment assessed for A. Bright lighting. B. Loose rugs and clutter. C. Firm mattresses. D. High seating surfaces. Answer B. Loose rugs and clutter can pose tripping hazards, increasing the risk of falls for clients. When assisting a client with a bath, the HHA should A. Leave the client unattended for privacy. B. Check the water temperature to ensure it's safe. C. Use bath oils to moisturize the skin. D. Bathe the client in cold water to invigorate them. Answer B. Ensuring the water temperature is safe prevents burns and ensures the client's comfort during bathing. In the event of a fire in the client's home, the HHA's first action should be to A. Attempt to extinguish the fire. B. Rescue the client from immediate danger. C. Call emergency services. D. Close all doors and windows. Answer B. The immediate priority is the client's safety. Rescuing them from danger is the first step before taking further action. When a client is on a fluid-restricted diet, the HHA should A. Encourage the client to drink water frequently. B. Monitor and document all fluid intake. C. Provide beverages with every meal. D. Disregard the fluid restrictions if the client is thirsty. Answer B. Monitoring and documenting fluid intake ensures adherence to the prescribed fluid restrictions and helps manage the client's condition effectively. To prevent the development of pressure ulcers, the HHA should A. Reposition the client every 4 hours. B. Massage reddened areas vigorously. C. Use pressure-relieving devices as recommended. D. Limit the client's mobility to avoid injury. Answer C. Utilizing pressure-relieving devices, such as special mattresses or cushions, helps distribute weight evenly and reduces pressure on vulnerable areas, thereby preventing pressure ulcers. When assisting a client with dementia during meals, the HHA should A. Provide a variety of food options simultaneously. B. Serve meals in a noisy environment to stimulate appetite. C. Offer one food item at a time in a calm setting. D. Allow the client to eat independently without supervision. Answer C. Offering one food item at a time in a calm environment minimizes confusion and helps the client focus on eating, promoting better nutrition and safety. A client with chronic obstructive pulmonary disease, COPD, is experiencing shortness of breath. The HHA should A. Position the client flat on their back. B. Encourage rapid, shallow breathing. C. Assist the client to a sitting position and encourage pursed lip breathing. D. Provide fluids to induce coughing. Answer C. Assisting the client to sit up and encouraging pursed lip breathing can help improve airflow and reduce shortness of breath in individuals with COPD. When caring for a client with a urinary catheter, the HHA should A. Position the drainage bag above bladder level. B. Disconnect the catheter for bathing. C. Ensure the drainage bag is below bladder level to prevent backflow. D. Inflate the catheter balloon if it deflates. Answer C. Keeping the drainage bag below bladder level prevents urine backflow, reducing the risk of urinary tract infections. If a client begins to choke and cannot speak, cough, or breathe, the HHA should A. Offer water to drink. B. Perform abdominal thrusts, Heimlich maneuver. C. Encourage the client to lie down. D. Wait to see if the client recovers independently. Answer B. Performing abdominal thrusts can dislodge the obstruction from the airway, potentially saving the client's life. To ensure accurate weight measurement of a client, the HHA should A. Weigh the client at different times each day. B. Use a different scale each time. C. Ensure the client wears similar clothing and uses the same scale at the same time daily. D. Allow the client to hold on to a support during weighing. Answer: C. Consistency in weighing conditions ensures accurate and comparable weight measurements over time. When assisting a client with ambulation after surgery, the HHA should A. Encourage the client to walk quickly to build strength. B. Support the client's weaker side and use a gait belt. C. Avoid using assistive devices to promote independence. D. Allow the client to rest in bed until fully recovered. Answer: B. Supporting the client's weaker side and using a gait belt provides stability and safety during ambulation, promoting recovery. A client with a history of hypertension should have their blood pressure monitored. A. Only when they feel unwell. B. Annually during routine checkups. C. As directed by the healthcare provider, often daily or weekly. D. Every hour. Answer: C. Regular monitoring as directed helps manage hypertension effectively and prevents complications. When providing oral care to an unconscious client, the HHA should A. Place the client in a supine position. B. Use a large amount of water to rinse the mouth. C. Position the client on their side to prevent aspiration. D. Avoid oral care to prevent choking. Answer: C. Positioning the client on their side allows fluids to drain out of the mouth, reducing the risk of aspiration during oral care. To assist a client with limited hand mobility in maintaining independence during meals, the HHA should A. Feed the client entirely. B. Provide adaptive utensils with larger grips. C. Encourage the client to skip meals. D. Restrict the client's diet to finger foods only. Answer: B. Adaptive utensils with larger grips can help clients with limited hand mobility eat independently, enhancing their dignity and self-esteem. When a client expresses feelings of depression, the HHA's appropriate response is to A. Change the subject to something cheerful. B. Inform the client that others have it worse. C. Listen empathetically and report the feelings to a supervisor. D. Advise the client to ignore these feelings. Answer: C. Listening empathetically validates the client's feelings, and reporting to a supervisor ensures they receive appropriate support. The most critical reason for maintaining accurate and timely documentation is to A. Avoid legal issues. B. Ensure effective communication among the healthcare team. C. Keep the client occupied. D. Reduce the workload of the HHA. Answer: B. Accurate documentation ensures all team members are informed about the client's status and care plan, promoting coordinated and effective care. When caring for a client with a communicable disease, the HHA should A. Avoid entering the client's room. B. Use standard precautions and any additional recommended PPE. C. Provide care without gloves to build the client's trust. D. Share the client's condition with neighbors to alert them. Answer: B. Using standard precautions and appropriate personal protective equipment, PPE, protects both the HHA and the client from the spread of infection. To support a client's respiratory function, the HHA should A. Encourage deep breathing and coughing exercises. B. Limit fluid intake. C. Position the client flat on their back. D. Discourage movement to conserve energy. Answer: A. Deep breathing and coughing exercises help expand the lungs and clear secretions, improving respiratory function. When a client has a seizure, the HHA should A. Restrain the client to prevent injury. B. Place a soft object under the client's head. C. Force a tongue depressor into the client's mouth. D. Leave the client alone to maintain privacy. Answer: B. Placing a soft object under the client's head can prevent head injury during a seizure. Restraining the client or inserting objects into their mouth can cause harm.